Hello everybody, introduce us from SGD 3. We will present our student project about nasal polyps. And here are our group members. My name is Shrishli Alfaniapson with last 3-digit number is 118. First, I will explain about the background of our student project. Nasal polyps are abnormal non-cancerous hyperplastic outgrowth originating from sinus and paranasal sinus mucosa. They are benign, soft, painless, hanging down like teardrops. The most common manifestation is in patients with chronic rhinosinusitis and chronic nasal obstruction. Nasal polyps is estimated to occur in 1 until 4% of the United States general population. Anatomical and functional changes in human body such as diminishing mucus secretion and sinonasal mucus atrophy with decreased vasculature result in edema and chronic inflammation leading to increase in cell tissue and size. Thank you.
Although nasal polyps are benign and sometimes asymptomatic, nasal polyps and their underlying disease may affect patients' quality of life and future health risk problems such as obstructive sleep apnea, worsened asthma, and sinus infection. So we will discuss more about nasal polyp in this student project. Next slide. So the problems that we are going to discuss in this student project is 1. What is nasal polyp? 2. The epidemiology of nasal polyp. 3. The etiologies of nasal polyp. 4. How is the pathophysiology of nasal polyps? 5. How to measure the grade of nasal polyp. 6. The signs and symptoms of nasal polyp. 7. How is the diagnosis and what are the differential diagnoses of nasal polyp? 8. The treatment of nasal polyp. And the last one is the prognosis of nasal polyp. And the objective of course, that we know and understand more about all the problems that I just mentioned before. Next slide. So for the benefits of the student project, 1. Giving information and education about nasal polyps. 2. Gaining more knowledge about nasal polyp. And the third one is as basic information of nasal polyp for further research. Next slide.
The definition of nasal polyps. The nasal polyps, the term is formed by a word nasal and polyps. Nasal is a space inside the nose and polyps means a small growth that usually is benign and with a stalk protruding from a mucous membrane. Nasal polyps are abnormal inflammatory growth of paranasal mucosa that are caused by chronic inflammation of mucosa.
Epidemiology of nasal polyps. Nasal polyps mostly found in asthmatic patients with age over 40 years old. Frequency of nasal polyps increase with age, with peak in age over 50 years old. Frequency of nasal polyps in asthmatic patients aged 40 years old and more is 4 times greater than asthmatic patients below 40 years old. In children, the frequency of nasal polyp is extremely low, at about 0.01%.
Etiology of nasal polyp. The etiology of nasal polyp is poorly understood. There are 3 common areas of nasal polyp: localized, diffuse, and systemic. As the understanding of etiology of nasal polyp is crucial to treatment, this poor understanding can prevent a complete treatment. Localized nasal polyp typically arises from inflammatory or neoplastic activities. In elderly patients with wood dust exposure, sinonasal malignancy should be suspected if a unilateral nasal polyp is found. Inflammatory event that causes obstructive sinus ostia with bacterial infection can also be inflammatory cause of nasal polyp. Diffuse nasal polyp is usually found in patients with chronic rhinosinusitis, which is classified coarsely into with and without polyps. Factors such as T helper 2 cell-driven eosinophilic immunoglobulin E inflammation, bacterial superantigen response, fungal sensitization, atopy, and occurrence of allergic fungal rhinosinusitis or aspirin exacerbated respiratory disease are all possible etiologies for nasal polyp. Systemic nasal polyp has 2 key systemic disorders: Church-Strauss syndrome and cystic fibrosis. Nasal polyp occurs in 76% and 45% with those disorders respectively. Church-Strauss syndrome should be considered when faced with patient presenting with positive anti-neutrophil cytoplasm antibodies. Cystic fibrosis should be considered if the patient presents with positive sweat test with sinus CT showing total opacification and hypoplastic frontal and sphenoid sinuses. Thank you.
Okay, now I will explain about the pathophysiology of nasal polyp. So the pathophysiology is mostly unknown until now, but many people believe that it is due to the chronic inflammation of nasal cavity. There are several conditions that can trigger this multiple benign polyp formation. The most case is cystic fibrosis or CF, followed by allergic fungal sinusitis or AFS, bronchial asthma, allergic rhinitis, aspirin intolerance, alcohol intolerance, chronic rhinosinusitis, and primary ciliary dyskinesia. That's it from me. The next will be explained by my friend. Thank you.
My name is Berenger Faiz Delis, NIM 053. Nasal polyp grading. There are currently several grading methods for nasal polyp. Nasal staging system and the modified Lund-Kennedy endoscopy score are commonly implemented. Operative evaluation by functional endoscopy in surgery of nasal polyp uses the nasal staging system to identify the stage or grading. A nasal score of 0 means no polyp is observed. A score of 1 means a polyp is confined to the middle meatus. A score of 2 indicates multiple polyps occupying the middle meatus. And a meta score of 3 shows the polyp extend beyond the middle meatus. And lastly, a meta score of 4 shows the polyp completely obstructing the nasal cavity. A visual representative of nasal system is shown on the left side. And next, the endoscopy system of rating of Lund-Kennedy detects visual conditions within the nose and sinuses, including polyps, discharge, edema, and crust. A Lund-Kennedy modified score comprises of the polyps, edema, and discharge, and has a good reliability. The scoring system of Lund-Kennedy is given on the right.
Okay, I will tell about the sign and symptom of the nasal polyps. So the nasal polyps are often associated with irritation and swelling of the lining of the nasal passage, and also in case of the chronic sinusitis lasting more than 12 weeks. And the common sign and symptom in people with nasal polyps are runny nose, nasal drainage, nasal congestion, decreased or lost sense of smell, headache, facial pain, and feeling pressure in the forehead and face. Some conditions are often associated with nasal polyps, include asthma, aspirin sensitivity, allergic fungal sinusitis, cystic fibrosis, Kyrle syndrome, vitamin D deficiency, and history of family genetics can also play a role to develop nasal polyps.
Nasal polyps could be diagnosed in many ways, including conducting a comprehensive taking of the patient, carrying out a thorough physical examination, or using other methods such as nasal endoscopy and radiography. The clinical manifestation for nasal polyps is respiratory distress and loss of sense of smell. For the CT scan, there is an image of oval hypodense mass that shows inflammatory polyps. The radiological finding will be evaluated using Lund-Mackey scoring system. Unlike the CT scan, which sometimes could be susceptible to misdiagnosed nasal polyps because of overdiagnosing and incapacity to distinguish mass lesion from inflammatory tissues, diagnostic nasal endoscopy are more adaptable in those mentioned above. Both CT scan and nasal endoscopy are the recommended supporting examination for nasal polyps. However, diagnostic nasal endoscopy provides a more in-depth understanding of the nasal polyp condition. Thank you.
The differential diagnosis of nasal polyps are chordomas, anthracoanal polyps, inverted papillomas, Schneiderian papillomas, squamous cell carcinoma, non-Hodgkin lymphoma, melanoma, esthesioneuroblastoma, hemangiopericystoma, nasal duct cyst, nasal gliomas, encephalopellis, juvenile nasopharyngeal angiofibroma, rhabdomyosarcomas, and hemangiomas. This differential diagnosis can be ruled out by the method of biopsy and histopathological examination.
So for the treatment or management of nasal polyp, first thing first, for the initial treatment, patients are given intranasal corticosteroids along with attempting nasal saline irrigation for 2 until 3 months. And the commonly used intranasal corticosteroids are mometasone furoate, budesonide, and fluticasone propionate, and they can be consumed twice daily. In some cases, eosinophils number in the nasal polyp tissue is elevated, for example in chronic rhinosinusitis with nasal polyp, and due to this, initial treatment can be unresponsive. Hence, surgery is recommended for these cases. The surgery, known as FESS or functional endoscopic sinus surgery, is beneficial for short-term therapy to alleviate the symptoms as it removes tissue obstruction and restores mucosal drainage to normal. But as it doesn't fix the etiology, recurrence is common in the long term. To decrease the probability of recurrence, steroid-eluting stents can be implanted during the surgery, and it is advised that initial treatment can be maintained. Thank you.
Okay, I will explain about the prognosis. So, nasal polyps are not causing mortality, although they may lead into life-threatening complications such as the altering convolution that could lead to orbital fault. Patients with rhinosinusitis could complicate the nasal polyps, with tissue neutrophil as potential cellular marker for disease control status of nasal polyp with rhinosinusitis. Eosinophil is a marker that summarizes that the heterogeneity of nasal polyp as non-eosinophil marker, leading into other different prognostic factors. The prognosis is also determined by disease process endotype. Patients with allergical fungal rhinosinusitis has higher number of recurrence. Patients with asthma or aspirin sensitivity is proven to be more extensive and high recurrence. Presented at a younger age, higher Lund-Mackey score, high global osteoitis, and elevated tissue, eosinophil and neutrophil. Also, treatment options are dependent for the prognosis of nasal polyps.
Nasal polyps are abnormal inflammatory growth of paranasal mucosa. It can be found in asthmatic patients with age over 40 years old, especially patients with severe steroid-dependent asthma. It is considered to be related to autonomic nervous system, genetic predisposition, and chronic inflammation. Nasal polyps can be classified with several grading methods. In patients with nasal polyps, it is common to find irritation, swelling of the lining of the nasal passages. History taking, physical examination, and some laboratory tests are used to help the diagnosis.